Well, one of the things about Sovaldi that differentiates a little bit is there's just huge numbers of patients with Hep C. I mean, there's this bolus of patients, baby boomer age patients coming through. So I mean, there are a huge number. I think that's one of it's which doesn't come as much as any single cancer type and any drug for one of the NIBs or whatever to be done. I mean, I think that's what really put it up as a volume.
The problem there was price and volume, right?
It was really a volume issue, which made it so intense. If it was a less common entity, it would not have probably reached this, and we wouldn't have gotten this price movement as quickly.
But the price volume and a desire to treat everyone early. You know, if you had the potential to cure hepatitis C, there was an imperative to do it in a lot of your patients, whether it was clinically appropriate or not. People don't want to walk around with hepatitis C. But I do think we're going to see in the near future products that aren't necessarily high volume products, but could have substantially higher prices. When we start talking about cell and gene therapy based approaches, you could see literally in the gene therapy realm, maybe not in oncology, but in other spaces, you can see gene therapy approaches that are literally priced at $1 million, where the cost of goods is $200,000 or $300,000. So I think that probably requires us to have a discussion about different ways to finance these things and to potentially amortize these costs.
So I get the Sovaldi story is kind of rose so quickly because of the volume, but the way that the story unfolded, it was Merck pushing that second to market product at significant discounts to ESI. Abbott, sorry.
And actually what happened was, this is fascinating, when Gilead had their conference call, and this is the AbbVie drug was introduced. And if you look at what Gilead's stock did the next day, it basically went down like crazy because they revealed that they were going to have to discount the drug by 50%, upwards of 50%. So it is a startling example of what happens when you have competition into a market.
Okay, so, but I look at TKIs and renal cell. You've got 5 drugs.
Take TKIs and CML. It's an even better example.
Right, but so why has that happened? Why did it happen with Sovaldi? Why did none of the manufacturers pull that trigger? And go to one of the big PBMs and say, we'll do it for half?
Well, the question is now with the Hep C, have they learned their lesson? They're going to exploit it. But let's think about this for a second.
They being the manufacturers or the PBMs?
The PBMs. Let's think about this for a second. So CML side, a lot of these novel agents, we have gotten very, very comfortable with giving substantial financial rewards for extraordinarily incremental benefit. We just have done that. And now we find ourselves in the predicament that we actually have really beneficial therapy and we are uncomfortable with the idea of paying an equally scaled increment for the amount of value it brings. And we are guilty for this problem. We created it. CML is a huge issue, right? So we're old enough to have treated CML before imatinib existed. And it was a miserable disease to treat. You were always thinking, should I transplant? Shouldn't I transplant? Interferon stinks. It was a lousy disease to take care of. Patients did not do well, right? Now we got imatinib. Imatinib changed everything. It's pretty easy. Patients feel normal. It works like crazy. And so we had this rush to market with all these second and third generation TKIs, which gave us extraordinarily small incremental benefit. I have even said that I don't think they give any incremental benefit except in certain clinical scenarios. And I think that's a justifiable position. Now, what's happened? So the price of imatinib has come up a lot over the course of the product life cycle. And then we've got all these new, and there's still drug discovery going on in that space, right? So something's got to give. And whether the something is what, Express Scripts did with the hepatitis, is that the solution? Let the market and market forces drive costs down? We're still going to be faced with the challenge of these really new, exciting, innovative therapies that are truly breakthrough, not just what the FDA says is breakthrough, but really breakthrough, and having to price them right. So the fact is that perhaps the greed of the manufacturer is going to help us here, right? So what we're going to see is the PD-1 and PD-L1 drugs all being approved for all the same things. And then the question is, can they be treated as a class, which will allow the market to influence the price? And we'll see. I don't know. We'll see.